Hi everyone. So if you're wondering why you're looking at my hands and not my wonderful face, it's because I just wanted to give you a quick demonstration showing you how dermal filler, once injected into the skin, can be dissolved if there's a problem. So dermal filler is made up of basically hyaluronic acid amongst other ingredients. But hyaluronic acid occurs naturally in our skin. But as we get older, we make less and less of it, hence the thinning out of certain areas of the face, thinning out of the lips, etc. So we inject hyaluronic acid to replace that volume loss. But occasionally, things don't quite go according to plan. It might be that the dermal filler has migrated from the original point of injection, giving a much more kind of lumpy and undesirable appearance. Or it might even be an emergency where dermal filler injected has somehow infiltrated a blood vessel, and because it's a gel-like substance, I'm going to show you in a minute exactly what the consistency is. Because it's a gel-like substance, there is a risk that it can block the passage of blood through that blood vessel, and thus creating an area of skin that's not being fed by blood, not receiving nutrients, oxygen, etc. So that area of skin potentially could die off if left untreated. So just to show you how dermal filler can be dissolved, in case you were worried about having dermal filler treatment and thinking, oh, it's a bit dangerous, it's very risky, I don't know what I'm letting myself in for, I thought this might help to just assuage some of those fears. So this is a recently expired syringe, which I'm not obviously going to use on any patients. A recently expired syringe of Stillage L dermal filler. Now L is typically quite a firm filler. It's generally used for areas like across the front of the face, across the cheeks, to try and replace lost volume. So it's quite a firm and quite thick filler in consistency. So I'm going to just squirt some out into this bowl so you can see the kind of gel-like consistency that it has. It's quite firm, and by the way, that's all that 1 ml gives you. So when people say, can half a ml do it? Well, you be the judge. 1 ml isn't actually very much at all. So this is 1 ml of a fairly firm, cohesive dermal filler. Now, if there were a problem and we needed to dissolve that filler quite quickly, we would inject a product called Hyaluronidase, or Hyalase for short, which is basically an enzyme that breaks down the dermal filler very quickly, as I'm about to demonstrate. So you can see the consistency of the gel, and I'm just transferring a little amount of the Hyalase to the gel, and you can see how quickly that starts to dissolve. I'll just take away the needle and just poke about in there. I hope you can see that. But you can see already the filler is starting to break up. And within less than a minute, in fact, you can see it's just dissolving before our very eyes. So the cohesivity, I think, I'm not sure. Anyway, the way that the dermal filler typically holds its shape is damaged by the Hyalase because it breaks apart that kind of stickiness of the dermal filler. So you end up with a filler that becomes much more liquid, which means that if it were blocking a blood vessel, because it's now much more liquid, as you can see, it's not holding its shape at all, blood can continue to flow through that blood vessel unimpeded, and the risk of those areas of skin dying off, as I mentioned earlier, becomes much reduced. As you can see, this dermal filler, now that it's been infiltrated with Hyalase, wouldn't necessarily block a blood vessel, and it wouldn't cause any kind of those significant effects that can come from having a blood vessel blocked during a dermal filler treatment. So you can see within a minute that Hyalase has gone to work and turned that dermal filler from a very sort of almost solid lump of gel into a much more liquid consistency, and broken up that solid lump into much smaller pieces, which means that again nothing will kind of cause a blockage of that blood vessel. So I hope this has given you a little bit more of an understanding about how we can actually treat problems such as potential blockages of blood vessels during a dermal filler treatment. I hope that gives you much more clarity and a little bit of reassurance that in the right hands you will always be treated with safety. Take care and bye for now.